We are happy to have Leslie Coleman, um, and she is going to be our presenter today of tips and tricks on traveling through this pandemic. We were just kind of discussing, we would have never thought this time last year this would even be a topic. We didn't even know what COVID-19 would have been, but here we are. So we have holidays coming up. We have people coming into our homes, perhaps us going into people's homes. So we just wanted to have a webinar to help us with tips and tricks and what we should know to travel safely and legally in COVID. So Leslie, would you like to introduce yourself?
Sure. I'm Leslie Coleman, and I am with Travel Designs MD in the great state of Maryland. I have been doing travel for the past 7 years now. I have an office at 202 Main Street in Reisterstown, and I'm happy to share some information because, it's really, trying times with people trying to move about the country, visit family and friends and things like that. So we're going to talk about what type of travel is available during COVID, the things that you need to know. And if you all have any questions, we'll take those at the end of the webinar. So one of the things that we're going to talk about is specifically COVID and how it's affecting our travel. We're going to talk a little bit about the state of air travel and cruise travel currently, how to protect yourself when traveling, and the different trends in travel right now. So, according to the CDC, traveling actually increases your chance of getting and spreading COVID. Just like any other virus, the flu, the cold, the more people you're around, the higher a chance of getting anything. And the best way to protect yourself is to not travel. Now, we don't want to do that. We still want to be moving about the country and seeing our friends and things like that. So there are things that you can do to protect yourself. During your travels, if you end up feeling sick or having symptoms, you should definitely quarantine to prevent spreading it any further. And when you come home, you also want to stay away from people generally for a 14-day quarantine. Please don't travel if you're sick or if you've been around someone who tested positive for COVID. You just never know. Some people are asymptomatic and never have a sniffle or a sore throat or the typical symptoms of COVID. So you can still be a carrier and not actually feel ill. So the things that you need to consider before you're traveling is, what is the COVID risk in your destination? Okay, in Reisterstown, what are the numbers in Reisterstown or Owings Mills? If it's a hot spot, chances are that you may have been exposed to somebody just by sheer statistical numbers. You also want to consider if you live with family members or you are around family members who might be older or have comorbidities that would put them in a higher risk category for getting COVID. So are you an increased risk? Do you have any other medical issues that might make exposure to COVID a higher risk for yourself? You definitely want to check your destination to see what the COVID is like there and what any restrictions are. Kathleen and I were talking before the webinar, and from state to state, it really varies what the restrictions are. Some states have an increase or a spike going on with COVID, and they may require travelers from another state or in that state to quarantine for 14 days, or they may not allow access at all. And the next thing that people really don't consider is, does your employer have restrictions when you get back from traveling? I've had a number of clients this season who really wanted to get away. They booked their trip, and all of a sudden they're told by their employer that they have to quarantine coming back from travel. So ultimately they end up having to cancel or postpone again. So the two most popular types of travel that we're dealing with right now is air and cruise travel. Considering that over 4.4 billion passengers travel by air, the risks are relatively low of contracting COVID during air travel. It also really heavily impacts our economy because just, worldwide, 11.4 million people work for the airlines. This includes direct aviation, so pilots, flight attendants, people at the counters, people who put luggage on and off. So that's a lot of employees who now have, been either laid off or furloughed for the time period. The risk of catching COVID or any other virus on an airplane is very limited because of the fact that, the circulation of the air in a plane recirculates every 2 to 4 minutes. So the air comes down from the top, is pushed down to the floor, and is recirculated out. The HEPA filters that are used in airplanes are extremely good, and they filter out about 99.97% of dust, pollen, mold, bacteria, and airborne particles, which is what we're looking at with COVID or the flu or even just, the common cold. So, as far as the airlines go, they have enhanced cleaning procedures now. They include spraying disinfectant down on the planes at least twice as that plane is going out. So it may not be between every flight, but they're doing it twice a day on that particular aircraft. I still highly recommend, if you take your own Clorox wipes and wipe down your tray tables, against the window, the armrests, and the buckles. They said that one of the most highly, I can't think of the word, areas where you can collect bacteria is behind the seat where the pocket is. Airlines have now taken out all of the magazines and things like that to try to eliminate some of the risks there. Now, cruise travel is probably one of the most misunderstood as far as contracting any type of diseases. In 2019, 30 million passengers cruised. Okay, 14.2 were from the US. And the cruise industry employs, 1.1 million employees. You always hear about a neurovirus on a cruise. Well, relative to anything else, the percentage of people who get norovirus out of 30 million travelers is 0.18%. Okay. We hear about it because it's in the media, but if you have a ship of 6,000 people and 100 of them get sick, obviously it's 100 too many people. However, it's relatively low in comparison. I have a graph here that shows, the major places where norovirus hits, and those are in healthcare facilities, nursing homes, places like that. Restaurants, 22%, schools and daycare about 6%, and within your own home about 2%. So cruise lines are doing pretty much the same thing that airlines are doing. They're installing HEPA filters in all of their systems. They are doing twice a day disinfecting, and they're applying masks, social distancing, and those type of things. Cruises are still postponed until the end of November, but they are starting to think about opening up January 1st with all of the new protocols in place. Now, each cruise line is a little bit different. So if cruise is something that you like to do, you can certainly go to that vendor's website and find out what their enhanced cleaning procedures are. So just like everything else we're doing in our day-to-day life, it's quite simple. Wear a mask, okay? Keep it on, when you're around other people, public transportation, airports, bus stations, train stations, things like that. Avoid close contact, remaining 6 feet apart. I've noticed in lines now that people tend to be closing that gap a little bit, but it's really important to stay away from the people who are in front or behind you. Washing your hands is the best defense for COVID, the flu, and any other virus. My husband and I have recently traveled on Southwest Airlines. We had the airport experience, and it was really nice. Now, the airports have the seats marked, every other seat so that people can't sit next to each other. Everyone has to wear a mask. The airlines are very diligent about people in the aircraft that have a mask on, making sure that they're worn properly. So washing your hands is also important. When you get on the airplane, either use sanitizer or you can use the restrooms to wash your hands. Always avoid touching your eyes, nose, and mouth, and take those Clorox wipes with you or some type of disinfecting wipe and wipe down the surfaces on planes, buses, public areas that you may be in contact with. All right, so travel is still trying to figure out what's going on. Every organization under travel, from the cruise line industry to IATA, which is the airline industry, they're coming up with new guidelines. Each individual country is coming up with their own guidelines, which unfortunately for us changes on almost a daily basis. As they get more information, they have to update their policies. So, today I can tell you one thing, but tomorrow it might be different. So a lot of companies are looking at their refund policy and the types of insurance that they're offering. Many companies now offer policies that have either a full refund or a future credit. Generally, the policies that offer you 100% refund back are a higher premium, and the future cruise credits can be used within a certain time period. The travel industry is very conscientious of the fact that travel keeps getting pushed back, so they are continually extending when those cruise credits or future travel credits can be used. And that's really important for the travel industry too, because they're all trying to stay afloat. So if they can maintain a client by giving them a future cruise credit or a future travel credit, then they can keep that money in the bank to keep their employees going and to get ready for when travel does resume at a larger capacity. Policies are different from state to state, country to country, and every vendor within the travel industry. So you always want to check what the policies are with your travel agent. You can go onto the different websites, including the CDC or any of the travel sites that list where US can travel to and where you can't. A lot of the trends in travel now are going to private guided travel experiences. These experiences are more comprehensive, and I don't want to say that they're necessarily more expensive, but for what you're getting, you're paying for those premium experiences. Private guided travel is the safest way to go right now. It may include a private driver who is vetted by the tour company. They have their own safe travel policies as far as disinfecting and what you can do. They're offering one-on-one experiences instead of having to take a tour with a group. You're traveling, with your travel partner or your family. So that makes it really nice. You can kind of get off the grid a little bit and not, worry about the other people that may be around you. Family travel has become very popular this summer, and a lot of it in the US revolves around national parks. So there are definitely safe ways to travel, either by car. You can travel by airline, which up through the end of November, many of the airlines still have the middle seat open, which is really nice. And when we book our tours, we try to minimize the number of stops or interruptions that you have in travel that might take you to 2 or 3 different airports or train hubs and things like that. With the family travel, we also have small group travel, which is geared towards, a close group of friends. Maybe you have 2 or 3 other couples that you want to travel with, or 4 or 5 girlfriends, and it's just your group. A lot of the places that we use for booking now are smaller, more boutique hotels, which don't have the large congregating areas, which makes it a little more intimate for travel, and you really get to spend some quality time with the people that you're traveling with. A lot of people this year not only have wanted to travel closer to home, but pretty much were forced to stay within the US. And again, doing trips like, national parks and places that are wide open spaces where you can be outside and not have to worry so much about, who you're coming in contact with. So the use of travel agents has been recommended for years by many of our industry partners. And I think a lot of people learned during COVID that having a travel agent was definitely worth it. We have spent countless hours on hold on the telephone with vendors trying to recoup money for our clients. Places like Expedia and the large box stores where all you have is an 800 number to deal with have been very difficult during this time. So the travel agents are the ones who go to bat for you, and they're the ones who are taking their time on the phone, emailing back and forth to make sure that if you had travel plans, that we can either postpone them or we can get your money back. In the future, a lot of travel agents now are going to be charging small fees, booking fees, that many times will be applied to travel. But as we found out through this industry, we probably spent 3 times the amount of time on a trip that we booked for someone because we had to, go online. We had to spend hours on hold. And if many of you don't know, travel agents work on a commission basis through the vendors. So in order for us to get paid, our clients have to travel. So you may see among travel agents in the future that, there will be booking fees, and, that's to protect them. And it's also, to give you the confidence that your travel advisor is going to be working for you. So these next couple of slides here are just some places to give you an idea of where US citizens can travel outside of the US. There are many destinations, but they all seem to have their own particular set of rules. Probably 98% of the countries that you can travel to at this point in time require a COVID PCR test. And those you have to have documented and take with you the day of your flight. Some countries require you to download to their website, and they have to give authorization before you can travel there. So it's always good to double check throughout the process to make sure that you're still in good position to travel. If you don't get authorizations from that country, then you're in a position where, you're sitting in an airport and you've just spent $3,000 on a vacation that now you can't go on. So, if you're working with a travel agent, they should be giving you all of the information and updating you out throughout the process. So these are some of the countries here that allow US travelers. And again, it's different for every country. So we still are not allowed into Europe or Canada, although we can go to Mexico. And there are some countries in South America that are slowly opening up to US citizens. Okay. Do we have any questions, Kathleen?
Well, that was really informative. We all appreciate you taking your time to do this. And I think that you covered a lot of questions that people have, especially why should we use a travel agent? And I think you gave a lot of good examples of that, because not only if there's a disaster and something happens, the travel agent can be on the phone versus you having to be on the phone. But also, isn't it about the same? Like, it's not that more expensive to use you versus going on and doing the booking yourself. Is that true? You're muted. Sorry.
Excuse me. So no, I mean, using a travel agent isn't going to cost you any more other than the fee that I stated before. And because travel agents work so hard during this time with no pay, it's most of us have had to reconsider, if this continues to happen, how are we going to stay in business?
Mhm.
So if you go to, I'll use Royal Caribbean as an example. If you go to their website and you look at a cruise, you're going to pay the exact same price that I'm going to get for you. And the industry does this because, they have to employ thousands of employees on their own. So by using a travel agent, they're working with us as partners, but they don't have to pay an extra 1,000 employees benefits and things like that. So they pay commissions to travel agents.
Mhm.
So you should be paying the same price no matter whether you book through a travel agent or you book through that company directly.
Okay. And just as a reminder for the attendees, if you do have a question, there is a Q&A. We have, let's see, we have a comment. I have traveled during COVID as well, and I definitely felt safe by the people around me and the airline team. The airport was relatively less busy as well. This has shed some light on the reassurance of working with an agent. Thank you. This was such an enlightening presentation. So that's a great comment about you and your presentation, Leslie. And I do feel like I think that cruises do get a bad rap in the media, especially because we think that that's how it all started. It started on this cruise and people coming over and bringing it with them. So I'm glad that you showed some statistics about your chances of getting a virus on a cruise versus going to the grocery store. Um, so I think that was
Yeah,
important.
I think it's really important to understand too, when COVID initially started, people weren't wearing masks. So, there is exposure that's happening when you're confined to, a smaller area and you're passing the same people over and over. So, I think we've learned a lot from this, but I think we've also learned about, protecting ourselves from other things as well. I was speaking with a travel partner who was from Australia. And one of the interesting things that they found, because they're coming out of their winter season into spring, is that their flu numbers were significantly down because people, number one, were wearing masks and washing their hands. My husband and I have been all over the place in the last 2 or 3 months. We've been to about 4 or 5 different states. We've traveled on air. We stayed in hotels. We've stayed in a couple of Airbnbs. And I really truly believe that it comes down to protecting yourself, and wearing face masks, washing your hands are probably the two biggest important things.
Um,
And also coming from a background being an EMT, we're used to that. So,
right. Well, it was great getting all that medical advice from you too. I recently just went to a hotel this past weekend, and it was nice to see that they had the remote control was disinfected and it was in a packet. And so I think that hotels are starting to make some changes, and so I don't know if this is the new normal, but I think it's something that we all have to just get used to and be a little bit more patient. And things may not be as fast as it used to be, but traveling during COVID can happen. You just need to be smart and safe, and make sure it's makes sense for you to do that. So
well, I appreciate your time today. And, if anybody has questions about traveling, I'd certainly be happy to answer them. My website is here as well as my number. And I really would like to thank the Chamber for constantly being supportive of all the small businesses here. And, for each of us, it's important for us to support the other businesses within our community, because we've seen far too many not be able to hang on during this time.
yeah, it's our passion and mission to help our community businesses as well as outside of our community as much as we can. And Leslie, you did mention before in our pre-webinar conversation that you have a couple webinars coming up. So would you like to tell people about that?
I do. I'm going to be starting webinars on the first Wednesday of each month. Our first webinar is going to be exploring the polar regions with Quark Expeditions. They are the most well-known private expeditions in both the Arctic region and Antarctica. And then in December, we're going to be talking about ancestry and travel. And we're first going to start off with Ireland on that, because I am of Irish descent. And, a lot of people are always looking to kind of get back to their roots. So we're going to have a presentation on that. I will be posting the links both on my website and on Facebook, and I will forward them to Kathleen to send out to the Chamber.
I can't wait for the ancestry one. I really need to get to Ireland. It's just pulling at me. However, I'm scared to go because I don't know if I'm going to come back. So I feel like I'm going to find my tribe or something. I don't know. So anyway, well, Leslie, thanks so much for your time today and your expertise and the valuable information. Once again, thank you for attending, those that were able to make it. And this will be posted on our YouTube channel, so it'll be on demand as needed, and you can share it with your friends and family as well. So thanks again, Leslie, and don't hesitate to contact her if you want to get away for a wine trip or any fun trip, group or so. We wish everyone health and safety. And Leslie, it was great to have you on today.
Thank you very much.
Okay, thank you.
Take care.